Okay, so we've recently been hearing from a lot of people saying that we should be letting herd immunity run its course, and how we should open everything back up, get everyone sick, and then get over this as quick as possible. Funnily enough, it's anti-vaxxers who used to deny herd immunity's very existence who seem to be believing it wholeheartedly now. The concept of herd immunity is simple. If you've been vaccinated, you not only protect yourself, but also people around you. Viruses need us to spread them. If you can't physically find a body to infect, you can't spread. A few leading epidemiologists around the world have come out saying that deliberately letting people get infected is the answer. But the thing is, this won't work for a few reasons. One, first and foremost, herd immunity is a preventative measure, a positive side effect of vaccines. We don't let deadly infectious agents create this. Why? Three main reasons. First off, young healthy people do die and suffer because of coronavirus too. It's not just those deaths you hear about, but 20% of people in ICU are 20 to 44. Trust me, from someone who's been there a lot, ICU is traumatic. Not to mention the decent amount of reports showing that fibrosis, scarring that lasts forever, is also possible in COVID-19. Reason two why we don't use illnesses to create herd immunity, the whole flattening the curve thing that you've been hearing about. Especially with COVID-19, where you have a lot of patients in ICU for a long time getting ventilated. If you get too many people coming into hospital at once, you can't treat a bunch of them. We've been seeing this in Italy and New York. And from early days, from early studies, we knew that as healthcare demand increases, mortality does too. By slowing down the spread through distancing, we ensure hospitals can treat everyone who needs to be treated. But reason C, 3, whatever you want to call it, why we don't let people getting infected create herd immunity is because infection doesn't always lead to someone becoming immune. We know this from other diseases like hepatitis and measles, but the WHO even came out saying that a low number of people have antibodies. In fact, reinfection is very possible with COVID-19. Getting diseases doesn't make you immune or incapable of spreading the disease. You don't always mount a proper immune response, a lasting one either. A vaccine, on the other hand, has a specifically picked antigen that in most cases can't get you ill. Plus, it has a bunch of adjuvants, specific immune stimulating molecules or factors which maximizes the chance of you mounting a long-term immune response to the disease you're vaccinating against. It's a controlled, much less risky, much more effective way of becoming immune to a disease. I don't think most anti-vaxxers could tell you how a vaccine works. Me? I'm a tumor vaccine researcher, and my thesis was actually on how to maximize the efficacy of a brand of tumor vaccines. If you choose to put your trust in someone you saw on the internet, let it be me. Not because I said I'm a genius or an expert, but because I can and will show you proof if you want it. But I think the most stupid and illogical thing about this herd immunity protecting everyone argument is that the whole concept of hiding the vulnerable and letting young people get it to stop the spread is stupid. The R number of a disease is how many people on average you infect when you have it. To get the vaccination rate to recover from disease, we use this equation. Basically, the more infectious the disease, the more likely it is to spread. Therefore, the more people you need to vaccinate to have immunity to stop it from spreading to everyone else. But this all assumes that you have infection occurring uniformly amongst these. We know from recent measles outbreaks in areas where vaccination rates are low, how deadly missing links in that protection chain can be. Nursing homes and immunosuppressed populations who are trying to protect from this herd immunity plan will not get the benefits of supposed herd immunity if we infect everyone healthy. Ultimately, they'll still be susceptible to an outbreak because they haven't and are less able to mount an immune response to disease. All we do if we encourage people to go out and get it and get sick is we overflow hospitals and expose millions to not only death, but ICUs and permanent lung damage. All of this to not even guarantee yourself immunity. Look, we're in untested waters, but this is why even expert opinions don't count for shit when it comes to medicine. I mean, 99% of the people being listened to right now aren't even experts, but even experts can be wrong or biased. Right now, a lot of idiots are going viral with crazy conspiracy theories. Next time, I'm breaking down this self-reported genius who's popularized a method to get shit videos with so much misinformation to go viral. I'll see you next time on Medical Fact.